Hello guys, good afternoon and welcome to Example. In today's short topic video, we will cover the National Family Health Survey 5th edition of the National Family Health Survey. It is very crucial survey which is related to the health in the India. It is very important for us. So we will cover what is the main features of the key features of this survey, what the important things or what the important points which is relevant for our upcoming examination, which is important things. The National Family Health Survey 5th edition of this survey is completed, and which is the important data. The important data related to this survey is the important data is National Family Health Survey 5th. The survey on the socio-economic and the health condition indicators was released. The socio-economic condition. What is the socio-economic condition? This is related to the previous 4 rounds were conducted in 1992, 93, 98, 99, 2005, 6 and 2015, 16. That means this health survey is not on the regular basis from 1992, 93. It was started in 1992, 93. First time it was conducted in this year, and after that, after the 5 year, it was conducted in 1998 to 1999, and after that the 5 year 2005 to 2006, and after the 10 years. So there is no regular interval is found in this survey. So it is not released on the regular basis. Okay, so 4 National Family Health Survey has conducted, and now the 5th one was conducted, and the data released of the 5th one. What is the key outcomes of this survey? Demographic shift in the India. First time since the National Family Health Survey began in 1992, the proportion of the women exceeded men. 1020 women for the 1000 men. That means the sex ratio is increased in the India. Now that was a major concern. This was the major issue for the Indian governments and the Indian society. But we have overcome that problem, and now the number of females has increased. Now the number of females on the 1000 males is 1020. That means but 20 females is exist. ठीक, तो family health survey में this is the important data. Now the sex ratio is 1020. Okay, in 2015-16, 991 women were for the every 1000 men. In 2015-16, the number of women at the every 1000 men was 991, but now the number of the women is increases than the men's. It is also the problem. There should be the balance between the number of the population of the men and the women. No one is increasing because there is a many major problems as arises due to the excess number of any particular gender. So we have to try to make a balance between the number of men and the number of the population of the men and the population of the women. Kerala among the highest ratios of the women to men, 1121 sex ratio at the birth. That means in the Kerala the number of women at the birth time period 1121 at the per 1000 men. So it is a highest. 4 children born in the past 5 years only the improved. So it is very important. It is very crucial data. तो आपको ये ध्यान रखना है इसको. From 1990 per 1000 males in 2015-16, 1929 per 1000, the total fertility rates declined from 2.2 to 2.0 at the national level. So that means the total fertility rate is also decreasing, and the earlier fertility rate was 2.2 and now the fertility rate is 2.0. That means 2. So it is also important. The urban total fertility rate is 1.6 and the rural fertility rate is 2.1. So you have to point out this point, you have to notice this point, that the urban total fertility rate is less than the rural fertility rate. The rural fertility total fertility rate is 2.1, whereas the urban total fertility rate is 1.6, which is less. Only 6 states, Bihar, Meghalaya, Manipur, Jharkhand and the Uttar Pradesh have the TFR above the 2.0. Yani the total fertility rate is more than 2.0 is only in the 6 states, and these 6 states are named here. That was Bihar and Uttar Pradesh, Meghalaya, Manipur and Jharkhand. Okay. Obesity is a major issue, is a major problem, health problem in the India. 56.7% of women and the 47.7% of the men have a high risk waist to hip ratio. Obesity means मोटापा, ठीक है. तो फीमेल्स में मोटापा ज़्यादा होता है, वेस्ट एंड हिप रेशियो जो होता है उसमें फीमेल्स में ज़्यादा है मैन के कंपैरिजन में. तो मोटापा बेसिकली अगर देखा जाए तो इन द फीमेल्स द ओबेसिटी इज मोर देन द मेल्स. ओके, तो ये इशू है, प्रॉब्लम एक इशू है. ओबेसिटी इज अ मेजर इशू इन द इंडिया. सेकेंड वन इज द एनीमिया. Anemia means lack of the blood, and it is also a major problem in the females. Okay, the proportion of the anemic children 5 to 59 months increased from 58% to 67%. Now we have the overcome on the anemia, which is in the children, which was the general thing in the India. So now we are overcoming this type of the disease. Women age 15 to 49 who were and anemic increased from 53 to 57%. So there is a problem in the women's, which is in the age of 15 to 49. That means this is the time period of the females in which they are facing the menstrual cycle. And during the menstrual cycle, they releases the bloods releases from their body. So the amount of the blood is decreasing, and which is cause for the anemia. So it is focused main. It is the main focused is the female to improve the blood amount in their body, and they can make over herself from the anemia. Another malnutrition indicator: children having the stunting and the wasting decreased by these percentage points compared to the National Family Health Survey 4. That means जो children हैं उनमें कुछ improvement हुआ है. Population prediction: India is still poised to be the most populous country in the world. India would overtake China as the world's most populous country around the 2031. At the present time, the world's most populous country is the China, but in the growth rate of India, the population growth rate in the India is very high. So we will surpass the China in the population by the 2031. So after the 2031, India will be the most populous country in the world. So after 2031, so it can be asked in your PCS examination कि after which year India will become the most populous country in the world according to the National Family Health Survey. According to the World Bank, after 2027, India will become the most populous country of the world. But according to the National Family Health Survey, the India will become the most populous country after the 2031. So it is there is a two different datas which is given by the two different institutions. One is by the World Bank and another is by the National Family Health Survey. It is the national data and that was the international data. Significant improvement seen. Which improvements has seen into our health stability or the health system? Population has stabilized. Although population is increasing, but the rate of the population is not increasing. Okay, the rate of population is decreasing, but population is increasing. So population will be increased, but stability is seen in the population growth rate. Total fertility has fallen below the replacement rate of the 2.1. If the total fertility is decreasing, that means the rate of increment will be decreases. The total population growth rate will be increased. No coercive measures are needed. Improvements in the economic and the social status of women. There is a economical social status has increased in the women. So women operating banks accounts and the owning house and the land is increased. The women which In traditional society, in Indian traditional society, there is no any economical role of the women's in the our economy, or the no many social or the more social importance of the women. But now at the trend is changing. At the present time, the economical participation of the women is also increasing, the social participation is also increasing. That means the social and the economical status of the women is increasing in our society, in the country. It is also the good indicator for the healthy society. It is a good indicator for a healthy nation. Okay, so we are moving toward the better things, betterments. Accessible healthcare. The major issue was to India, that is, there is no accessible healthcare. Now the healthcare is providing to the rural areas. Now the healthcare is providing to the remote areas of the country, so that the person, the peoples can access to the healthcare. It is a major concern for the health authority of the India, the government. It is also the major concern for the government of India. The rise in the institutional delivery signifies that the secondary healthcare system. Now, the delivery system in the India was in the conventional manner, in the conventional time period. There will be no institutional delivery. That means the delivery was not taking place. Delivery was not done in the hospital, but delivery was done in our households, in our houses, by the local guys, by the local daimas. Okay. But there will be the very risk to infants also, very risk to the women which is giving the birth to the child. Those, so both are in the risky condition. But when the delivery is institutionalized, then the risk of this death of the women and the child both is decreased. So institutional delivery has increasing. And the government has issued many schemes. Government has issued many schemes to attract the people to the institutional delivery. To delivery into the hospital is very important things. And we have seen the increment in this institutional delivery. Insight in the lifestyle disease prevalence measured blood sugar and the hypertension in the population for the first time. And it is in this first time, in this health survey, that means in the 5th health survey, the first time it is also measured that the hypertension, that means the person of India, this is the major things in which the hypertension is a major problem into the India, in the youth also, like the Siddharth Shukla was dead due to the hypertension, due to heart stroke. The hypertension is also cause for the heart stroke. Okay, and the blood sugar is also a major problem. And the very first time, tooth disease also considered in this family health survey. What is the current problem? What is the current issues we have faced? We have faced the pandemic, which is known as the COVID-19. So major threats arisen after the pandemic. Census is reliable. NFS figures do not give an accurate picture of the India's sex ratio because of smaller sample sizes in the district. NFHS counts only certain women collected under unusual condition of the COVID-19 pandemic. This survey is not the actual survey. This survey is not give the actual data. It does not surveying in the entire country. It collect some sample, and on the basis of that particular samples, they conclude the entire picture of the entire nation. So it is not actual data. It is not very relevant. It is not very reliable data. It is the most reliable data is the census of the country. Census is very reliable because in the census, every particular single person or the single person is participated. Every person is counted by the different modes of the counting. Lack of the adequate the micronutrients. NFHS does not have the data on this regional divide in the India. NFHS is not focused on this type, the micro level analysis or the micro level data. So it is a very important thing, which is we cannot conclude the entire picture of the nation on the basis of this type of data. Okay, way ahead. Ramping up the social infrastructure, having the includes action plan backed by the solid resources and the checking unethical practices and the malnutrition. What should be the way ahead for the health, to improve the health of India? This is the way ahead. National Family Health Survey, it is the representative sample of the household. Ministry of the designed TIPS as the nodal agency. ठीक है, तो TIPS is a nodal agency. Ministry of Health and the Family Welfare के अंडर में ये होती है. So it is a very important, it is a things related to the National Family Health Survey. So we will meet in the next class. Thank you so much.